Uh, Hello, and welcome to the brand new session of Career Talk series with a budding doctor, Dr. Kathija, who's a dentist and a dynamic personality who promises to deliver more than dentistry to the world. She's a vivid entrepreneur and a health enthusiast. Kathija is one person who lights up the entire world around her. Kathija completed her Bachelor of Dental Sciences from Vinayaka Mission Sankaracharya Dental College, Salem, and did her internship at various dental clinics around Tirupur. Today, I, along with my colleague Priyanka, are excited to have Dr. Kathija to share her journey, struggles, and insights into building a career in dentistry. Welcome, Doctor.
Yeah, so good afternoon. So my name is Dr. Kathija Sultana. I'm a dental graduate. Thanks for the well intro. And I'm excited to share my journey, experiences, and insights about dentistry, what it's really like, the opportunities it offers, and what it takes to thrive in this career. Yeah.
Yeah, Kathija, awesome to have you over here. We're all as excited as you are. Let's start with our questionnaire.
Yeah, sure.
Okay, so now let's start the personal journey of Kathija. Let's start with your story, Kathija. What made you choose a dentistry, and did you ever consider other medical fields? How was your journey?
Yeah, first of all, thank you for the question. Like, I have the chance to share my journey. Many of you, many of them, my first dream was to join as an MBBS, but I didn't score as much as, and my health was not in the favor. So that's how I entered dentistry. At first, it felt like a compromise, but as I started learning, I discovered that dentistry is not a backup plan, but a specialized field where its own value is more than it's not comparable, but it has its own value. Yeah, so dentistry gave me something I didn't expect, a chance to blend a medical field into artistry to transform not just health but also people's confidence with smile.
Very true, very true. That's very true.
So beautiful answer it was.
So my name is Dr. Kathija Sultana. I'm a dental graduate. Thanks for the well intro. And I'm excited to share my journey, experiences, and insights about dentistry, what it's really like, the opportunities it offers, and what it takes to thrive in this career. Yeah.
Yeah, Kathija, awesome to have you over here. We're all as excited as you are. Let's start with our questionnaire.
Yeah, sure.
Okay. Along with me, I have Priyanka, Priyanka is a career counselor from Pune. Priyanka, have a few words about yourself.
Yeah, sure. So, thank you, Saira. Hello, everyone, and Kathija. I'm Priyanka Jaswal, career counselor and co-host for today's session. It is pleasure to be interacting with Dr. Kathija and learning from her journey in dentistry.
Yeah, hi. Okay, so now let's start the personal journey of Kathija. Let's start with your story, Kathija. What made you choose a dentistry, and did you ever consider other medical fields? How was your journey?
Yeah, first of all, thank you for the question. Like, I have the chance to share my journey. Many of you, many of them, my first dream was to join as an MBBS, but I didn't score as much as, and my health was not in the favor. So that's how I entered dentistry. At first, it felt like a compromise, but as I started learning, I discovered that dentistry is not a backup plan, but a specialized field where its own value is more than it's not comparable, but it has its own value. Yeah, so dentistry gave me something I didn't expect, a chance to blend a medical field into artistry to transform not just health but also people's confidence with smile.
Very true, very true. That's very true.
Yes.
Yeah,
so beautiful answer it was.
Thank you.
Yes. Definitely. And as far as I know, it has a lot of practical and hands-on connected with dentistry, right? Compared to medicine, it has a lot to do with your practical skills as well as your artistic skills as well.
Yeah.
Okay.
Sure.
So coming back to the next question, thinking back to your school days, how was your journey leading up to NEET, and what motivated you through it?
Yeah. So I started my NEET preparation with a clear goal. No, I'm just going into an MBBS. Then my routine was so disciplined, focused. Like I will be theory blocks in the morning, solving questions in the afternoon. Like it was a very scheduled time. There were long days, sacrifices, like unsettled nights, crying, weeping, everything was there. So what kept me going was a mix of things, like the dream of helping people, small wins through your difficulties, giving repeated mock tests, and encouragement from your family, your teachers, and the mentors you have. So, visualizing all my future self is in a white coat that kept me going towards a need. And when results didn't go as I expected, it was like a setback. But instead of seeing dentistry as a second choice, I explored it properly. The clinical skills, the immediate impact on patients, like their appearance, their smile, their confidence, the pain relief, and importantly, the scheduled, structured hours where we can have a balance between work life balance. Yeah. So that reframing from backup plan to purposeful choice.
Wow,
So
that's
that's how
actually
my
excellent.
plan was.
Excellent way to actually look about things, not just dentistry, but any other
Yes.
field as. Yeah. So yeah, many students here are after NEET, like almost like
Yeah.
there are 21 lakhs of people who write the NEET exam and very, very few crack it. So could you tell us what your preparation strategy was? Because these days we find the NEET is so difficult even to crack BDS. We shouldn't say that BDS is any lesser, but then cracking BDS is again so difficult. So how did you balance your coaching classes with self-study, and how was your time schedule and or your timetable basically?
For me, coaching gave the structure and concepts, but self study was where the real learning happened. So I made it a rule to revise class notes then and there on the same day and practice some extra questions, giving mock tests repeatedly. So mock tests were my checkpoints. Like balancing both was about routine. Learning in the class, self studying to master, and test for giving like the best results. You can know from your mocks where you really stand. So quality mattered more than the long hours. It doesn't matter how many hours you gonna study. It just matter the consistency, how well you are focused during. Even if it's a 1 hour, it's a focused one. That's more than enough. Yeah, consistency matters.
Yeah.
Yes.
Definitely. Just like all other fields, consistency definitely matters.
Yeah.
If you had to sum it up in one line, what's your key piece of advice to people who are preparing for NEET these days?
Yeah, definitely. I will say the same thing. You shouldn't chase the long hours. You should chase the consistency. Even two focused hours daily can beat 10 distracted hours. Yeah. So stay steady, study healthy, like stay healthy. Health is really very precious when you walk through this journey, because I have that experience personally, and trust your journey. It will make you.
Very true. Yeah. Personally, yes, I have known that how she has struggled through her health because of long working hours and the stress and all that. Yeah,
Yeah.
good that you made it anyways. Coming to your college life, after NEET, you entered dental college. How was your transition from school to dental college? How the professional setup and how was the transition basically?
So speaking about like school to college, the transition was really so great. The school to dental college was exciting, but it was really challenging at the same time. In school, everything was spoon fed, right? But in college, I had to be more independent. You should manage your studies, you should manage your clinical time, your personal life on your own. So what made it enjoyable was exploring new clinical skills, the new budding friendships, and slowly realizing that I'm entering into a professional. I'm not a student
Mhm.
anymore. So it was both exciting as well as challenging.
Right. Yeah, very much. We can think about it. Okay, coming to your professional, I mean, your college life, what was your favorite subjects? What are the subjects which kind of was challenging, and what were your favorite, and how did you manage them?
Uh, Speaking about favorite subject, it was more about like physiology, and it's the more challenge I faced was I'm being a left-handed. Being a left-handed in dentistry is where dentistry is made mostly for right-handed people. So at first it felt uncomfortable to adjust in pre-clinic and clinical work, but with patience, creative positioning, and tips from the seniors and mentorship from teachers, I just slowly adapted. It's like a passive learning. So it actually taught me the real patience, the flexibility, and that no limitation is permanent if you're willing to do it consistently. Yeah, so that's how the challenge was from me, from left-handed to being comfortable with my own dental chair.
Yeah, completely agree. I mean, only now it strikes me that you are a left-handy. Yeah, let's
Yeah.
talk more about it. Being a left-handed, and how did you actually? I mean, even in the tool making or the setup making would have been difficult. But then for the patients, how did it happen? I mean, the left hand would because most of the tools, as you said, we have to use it
Yeah.
in the right hand. So how did you manage, and how did you actually cooperate with it?
Yeah, that's what. Because usually in dentistry, it's not about only in dentistry. Usually, chairs or whatever the tools or will be majority of the people of right-handed, right? So,
Yes.
being a left-hander, first day when I enter my preclinical lab, it was really challenging. Everyone they just started doing their preclinicals. I was then suffering with my hand, the positions, everything was really challenging. But what made me to come through is the practice. Like I practice more even when the college is off. I just go sit there. I'll just make sure from which side I'm more comfortable. So everything, the practice made me through what I am. Then slowly I adapted. And what happened is when I'm about third year, my college implemented a left hand chair in every other department. So it made it even more little easier. Now it's like mandatory to implement a left hand chair. So now it's not a problem anymore, I guess. But during my initial days, it was really very difficult. But
Yeah.
it doesn't affect patient in any way. It's only about dentist. It happens with practice. Yeah.
Okay. With changing times, things are evolving. That's nice
Yeah.
to know. Okay, coming to the same question, how is practice very important, hands-on? And while choosing a college, how do you think this hands-on practical training is important? How much it matters?
Yeah. It's like a bread and butter. Okay. So in dentistry, theory gives you foundation. It gives you foundation. But hands-on practice is everything what makes you a real dentist. That's what it makes you differentiate from other dentists. So you can memorize any book, but unless you develop a hand skill to handle the instruments, work on patience and build precision with your hands, you can't truly practice. Theory tells you what to do, but only practicals will teach you how to do it. So unless you practice your hands on, you can't nail the dentistry. Dentistry is more about the art of hands on doing. Theory is like a butter where
Right.
practice is hands on
The
is
bread.
like skills is everything like a bread.
Right,
Without
right.
that we can't survive.
Very true,
So,
very true.
so medicine with your artistic skill, no? So
Yeah.
blend of
Yeah.
that.
Yeah.
Okay, and as you said, the schedule and everything in college with the hands-on practice and being a lefty, everything would have been tough. College would have been really tough. Did you ever think of giving it up? And anytime there was a breakdown period or something like that?
Okay, so here I want to be honest. So absolutely, there were many times I will be crying. I just wanted to quit. I just want to run. I want to escape anywhere, especially during health issues. As I told you, my health was not at my favor. So low mock scores or well left-handed tools, when left-handed tools were not there, I just thinking of I really did a wrong choice choosing dentistry. Yeah, so that things really made me harder. But what kept me going was like thinking why I started, why I really entered here. So that made me really more going. And small wins are when you treat a patient, that patient smile and their pain relief, that brings me gratitude. Okay, you are making someone smile way more better. So that's how the quitting suppressed over my like it was really hard, but okay, I hadn't give up. And now the tiny wins and people who believe in you will keep you moving.
Yeah, yeah, that's very nice. I mean, once you see a person smile, I think you understand it all.
Yeah, that's what
That's
the confidence I get more.
it. Yeah,
Yes.
nice to know. Now I'll just pass it on to Priyanka so that she can ask a few questions.
Yeah, Kathija, thank you, Saira. So let me just take the conversation ahead. Kathija, just you explain about your that left hand issue, no? So, what initial hurdles apart from this did you face after completing your degree, or how did you overcome that? If something is there.
Yeah. So after completing from already the student to college was really challenging. Again, from passed out graduate, it was really challenging to face the world. So after completing degree, the biggest hurdle was the transition from student to profession, not being any student anymore. So suddenly you are expected to make your own decisions. You should handle the patient with confidence and manage responsibilities, time management. Everything will be on your own. So first, it was really overwhelming. I overcame it by leaning on mentorship from seniors, continuous self learning. That's what made me keep going, and reminding
Okay.
myself that it's okay to grow step by step. So,
Mhm.
confidence builds only based on the practice. Yeah, only through experience the confidence can be built. So, it was really
Yes.
hard. And what another hurdle you're gonna face is when you just completed your graduate and you're entering into a new clinic, the first thing they will ask is what make you unique, why I should choose you. So
Mm.
that will be the kind of questions they're gonna ask. So you should be confident enough to tell what skills you specialize in. So it's really like unique thing. It's based on how you speak, the communication skills, everything this mattered.
Okay. Okay. So, with the strong determination, no, you can do and you can achieve anything. No.
Thank you.
Yes. On the brighter side, can you share one proud moment that made all these struggle worth it?
Yeah, I just remember, like, I still remember that scene in my eyes, in front of my eyes. So, one
Yes,
of
please
my
explain.
proudest moments was giving a complete denture. When the age goes, the patient may feel like edentulous, like they lose entire teeth and they will be having problem to chew, to even speak their own insecurities. Everything will get built. So, that was my proudest moment when I was giving a complete denture to a patient. He was like he had completely lost his hope on smiling or eating properly, because there will be no nutritious if you hadn't choose your food. If you can't chew
Yes.
properly, there will be no nutritious effect that's remaining retaining in your body. So when he is wearing that, he just told me, "Amma, really thank you. I don't know how I should thank you." Like that smile was really precious.
Yes,
The
true.
way he could smile, chew, and even like after getting the denture, he just went. He told he given me like 1 kg of Mysore pak, all that things. Thank you for bringing my
Oh,
smile back again. And after going home, he just called me back after a week that Katija Kanne, how are you? All that. And he was telling, I'm really grateful to you. Like you are the one who brought light in my life. So that words are the proudest moment.
Yeah, yeah,
good to
completely
know.
agree.
Actually, that's so
So
nice to have you
inspiring.
here,
Yeah.
Katiza. Yes, so inspiring, actually. So,
Yeah.
in your views, what qualities and skills should a student develop to thrive as a dentist?
So, to thrive as a dentist, as I said earlier, dentistry is all about a mix of science, skill, and little heart. Heart means empathy to work towards a patient.
Yes, yes.
Yeah, you need a strong basics in anatomy. That's where the foundation is. So, strong basics in anatomy, the oral health, and you need really a skill, hands-on skill. Only with the practice you can develop that. And another thing is the empathy towards a patient, to treat them, to make them comfortable. First you should make your patient comfortable, make them fearless. You should explain your procedures clearly. So that's what matter. So these are all things you should be need to thrive in a department of dentistry, definitely.
So, in that way,
It's
communication
not
skill,
just
I think,
about
no?
treating teeth. It's always
Yes.
about treating people. Yeah.
Yes. So, communication skill in that way is also important, no?
Yeah. Communication is a key.
Yes.
Completely agree. Yeah.
Yes, yes. And importantly, is dentistry a stable and rewarding profession compared to medicine or other fields? What do you think?
Like if we compare dentistry with medicine, yeah, dentistry is still a stable and rewarding profession. Unlike medicine, it offers its own prestige, right? But dentistry is about a structured hours, fewer emergencies, and good work-life balance. So the scope is growing with cosmetic dentistry. It's more about now aesthetics, the
Oh,
how you look. So that scope is growing more about the cosmetic dentistry, the implants, and more about preventive health care. So which make it financially rewarding too. Yeah, that's in a good aspect. While medicine has its own prestige, dentistry give you independence, the flexibility, and the satisfaction of bringing your person smile back
Nice.
with a way
Yeah.
more confident.
Yeah. I'm sure
yes,
with more
very, very
dentists around, world will be a better place with people smiling.
Yeah.
true. Yes. And painless as well.
Yeah.
If we talk about career prospect in dentistry, how would you describe the scope of dentistry as a career today?
Like dentistry has its own aspects. The only thing is nobody has that much exposure. It's like a no scope after dentistry, no. But actually, dentistry is really vast. So, a growing demand for dental care. More people are like almost in world. Everybody are knowing that the oral health care. What are the wellness techniques? Even if it's not about preventive, they want to look good, they want to face
Yes.
confident, yeah. So coming into that field, if I look in my mirror, I want to look good. So that's where my confidence develops. So when they see their teeth are irregularly placed or when their missing teeth is there, so they just run to the dentist and tell, oh my god, I my smile is so insecure, I'm insecure with my smile, so please make me like a confident smile. So that's how it's more about aesthetic. That's what I'm telling. It's now developing more about cosmetic field, like veneers,
Yes.
aligners. That's where it's arising, and it's more about tech based. Now it's everything artificial intelligence, AI, robotics, and robotics guided surgery. Everything that had developed. It's like oral scanners, digital scanning. Now dentistry is more of like digital dentistry. Everything is
Oh,
painless, like in a shorter span of time, lesser appointments. So you just have a lot of scopes. It's not only about BDS, what after BDS. It's like way
yes.
more to do after BDS.
Actually, that is my last question. Actually, what are the different career path or specialization as a dental graduate can pursue?
So, the career paths after dentist you can choose is either you can do your postgraduate,
Mm,
just like a BDS bachelor, and you can apply for your postgraduate.
yes.
Again, you want to give 1 year of NEET, like you should do your NEET prep, the same thing, but little with more dedication and consistency. So that is the one step. Another one is if you did your postgraduate, you can either enter through academics, like you can be a professor, you can be joining any college and you will be having like a passive income, whereas by evening you can have your own dental clinic setup, that teaching roles where you can have your own clinic. Another one is joining corporate hospitals, and you can get into a research field. Here is what like nobody talks about. So research is really another great thing. In my college where I studied, so research is also way more important, as it was like equal, given importance equal to the theory. So I did my own research, like around I have completed my two research, I have published on my journal. So that is another, there you have a lot of scope, and financially it's stabilizing too. And you can join the corporates, like you can even be an entrepreneur side. So speaking of entrepreneur side, I want to be an entrepreneur. I'm just working toward it. Yeah. So you can do your own dental product development. You can join any dental equipment companies. So you can collaborate with so many dental chains are there. So you can collaborate with there. And another course is there. Like if you can't afford that much, for MDS, but still you want to gain a skill. See, if I have completed my BDS, maybe everybody will not be that much confident enough to treat patient alone confidently. So you can enhance your skill. There are a lot of small courses, or there is an option called FDS, that is the fellowship. It's of duration 1 hour. It's like more affordable, friendlier side. And another thing is like it will be equal to MDS. I can't just tell us it's equal to MDS. It will be not more ethical, but you will be like every patient you will be treating so many cases. Each case differs from patient to patient. So it's a fellowship course, but in Tamil Nadu, it's right now only Savita offers that FDS course. It's like 1 year fellowship. Yeah. And speaking of dentistry, everybody thinks dentistry is just a single doctor. No, it's completely wrong. Just like a medicine, how it has its own department, the cardiologist, the ophthalmologist, the skin care, derm, so everything. So in dental, there is 9 departments, 9 subdivisions, where it everything deals with separate things. Like for the teeth, we call it as prosthodontics. For aligning braces, we call it as orthodontics. So there are so many parts. For research, we call it as oral pathologist. So without a proper diagnosis, we can't do anything. Unless and until you know what the problem is, you can't cure. So everything has its own role. Yeah,
Very
it's
true, very
actually,
true.
I say, told it's too much.
Yeah,
It's
it's
a
true.
lot of things. Yeah. Only
So
because
so
we
much.
lack the exposure, we
Yeah,
just
we
don't know
don't know.
what to do
Yeah,
after PDO. Yeah.
Yeah.
blindly
So
we
many
just.
things learning. We are learning so many things from you, Kathija.
Yeah.
Actually, we
I'm
were
really
not knowing.
grateful.
Yes. So yeah, in that way, thank you so much for answering in that crisp manner. Actually, all the answers, and it is going to definitely help our students who are preparing for this and who are thinking about this career. So, Sarah, you can continue with that.
Yeah. One more question, as Priyanka had already asked. I want to know the career prospects of a dentist abroad, because we keep hearing that dentists are
Yes.
valued more in foreign countries than in India. So,
Yeah.
just give a few words about your career prospects in.
Yeah, okay, but I know what the scope has abroad, but I'm not clear with all other countries because every like if India, it's there something. I'm not that much clear, but I'll give you just a glimpse of that. So, speaking about dentistry in abroad, it's really way more scopeful than in India. The hurdle to get there is really too high because you need to give a competitive exams. Once you
Okay.
finish your BDS, you need to prepare the competitive exam. For example, if you're gonna end up in UK, you need to do an ORE exam. That is an ORE 1 and ORE 2. So there are two kind of exams where ORE 1 is purely based on theory based comes under ORE 1, and for ORE 2 it will be like a practical skill, the hands on skill you have learned throughout your dentistry, that will be. And the worst part is here the eligibility, the passing criteria is around 20 percentage. So
Oh,
you should,
Oh,
yeah,
really,
it's really
really
that
is.
much risky. You the efforts, the consistency are like if you're really confident that you will make it, you can choose that. If you are in dilemma, it's better not to be in a safer side. Yeah.
Okay.
So that's what. And if you wanna end up in Germany, and the speaking about ORE 1, ORE 2, the exam cost around 2.5 lakhs. So you
Okay.
should really give a thought. Should I really do it?
So
Yeah.
investing, yeah, yeah.
Yeah, because it's about time, the money, the your hard work, everything. It shouldn't go in vain. And if you're
Very true.
gonna do it in Germany to have really higher scope. But another thing is for Germany, you should have a language proficiency till B2. You should be well versed in the
Yeah,
German
B1,
language.
B2, we have to do it. Yes, yes.
So that till the advanced level, I guess C1 is the advanced level, but till B2 level, you should be passed and you should have that. And there is other. But speaking about financially, abroad has a better pay. Like even if you work as a dental hygienist or a dental assistant, you can earn around 2.5 lakhs per month
Oh, okay, that's a
there.
lot of money.
Yeah, but coming of ethical issues, even if you did a very small mistake, your license will be cancelled just like that. So there is both pros and cons.
Okay. Yeah. So it's not so easy as people keep thinking that you go
Yeah.
abroad and you
It's
can.
No,
Yeah.
it's really not easy. It depends on perspective and the ambition of a person, what
Yes.
they
Your
would really want to.
priorities and all those. Right. Right.
Yeah.
Yes. Yes.
Closing on a very lighter note, what is your favorite tool in dentistry?
Oh wow, this is really fun. Okay, let me tell you. Dental mirror. Have you seen in the dental mirror? If you have ever went to a dentist,
Yes. Yes.
the first thing they take is a dental mirror. So it looks so simple, but it's really powerful. Like it lets dentists see what the patients can't see. Even the dentist can't see the upper side of the mouth, what's having behind the scene. Yeah, so that is the dental mirror is the tool which make you
It's very
invisible the
funny.
visible. Yeah. It
Yeah.
solves problem by paying close attention to detail. So that's a really important tool in dentist.
So
Without that, no diagnosis.
next time, maybe when we will go to dentist, and definitely, I'll see that mirror again.
Yeah, you should definitely have a look at that.
Very
Yes.
true. What is your funny and memorable moment with the patient who's been made you laugh for a longer time?
Okay. So, speaking of funny moment, it will be about definitely pedo. So, pedo department, it's like treating kids. Like, in medicine, you will call it as pediatrics. In dental, you will call it as pedodontics. So, when I was treating pedodontics, yeah, odontics is nothing but a tooth.
Okay.
The meaning. So, it's a pedodontics. So, once I had a little kid as a patient who was super nervous. I was just comforting him, giving him ease, and talking. To distract him, I just asked, "What's your favorite? Who is your favorite superhero?" He just said Spider-Man. So when I was checking his teeth, he suddenly said me very seriously on a very serious note, like, "Please don't pull my teeth out. I need them to chew popcorn when I watch Spider-Man movies." So moments like these remind me how dentistry isn't just about treatment. It's
Yeah.
about like connecting with patients in human, sometimes more funnier way.
Yes.
Yeah.
I just remember that
It
incident.
determines complete yourself, your outer self, your inner self. What you put inside is also determined by dentistry, and how
Yeah.
you appear outside is also determined by dentistry. I mean, talking to you has given us so much of insight and so much of knowledge. Basically, people always think that dentistry is like the a step-up career or a backup career for medicine, but completely understand that it's not anymore. And we have a very promising field in dentistry. It's up to us to go and reach the sky. So we have a lot of prospects. As usual, only the person who's the best will survive. And there's a pure example of it. Thank you, Kathija, for sharing your journey, your enlightenment, your insights. And it was absolutely a delightful moment to have you over here. Thank you so much, Kathija. And I'm sure our
Yeah.
students
Thank you, Kathija, for
yeah, I'm sure our
Thank you.
students are
Thank you
very
for
much
having
happy
me.
today.
Both the host, you are so good. And thanks for this opportunity where I can share my insights, my funny moment, like what
yes.
is the things you know, the things you don't know behind the dentistry. So it was really worth the session. I
Yeah,
feel really
definitely.
like I'm just reminiscing all the moments of my 5 years, whatever the good, the bad,
Wishing you
everything.
lots and lots of success, both in your
Yeah.
personal and your professional
Yes,
lives.
Kathija.
Thank
Yeah.
you. Thank you
Thank
for
you
your
so much
confidence.
for being part of this session. Thank you so much.
Thank you. Thank you for your kind
Yes.
words.
Yeah.
Have a good day.
Thank you.
Yeah. Same to you.
Thank you. Can we?